Can you please explain what brain fog is and why you consider brain fog in long COVID to be more brain injury than brain fog?
It's an interesting term, brain fog. There's a famous quote, I don't remember who said it now, but one of the chief justices in the United States back in the day, he was involved in a case involving pornography. How do you define pornography? And he famously said, you don't know how to define it, but you know when you see it. That's what he said. And that definition, I think, applies to brain fog, right? Like, who knows how to define it, but you know it when you see it. If you talk to 50 different doctors, and I think I've done this, you'll get 42 different definitions of brain fog. You know, if you talk to 100 patients who don't like the term, by the way, they particularly dislike the term, you'll get vastly different definitions of what it means. They tend to feel, long COVID patients, that it's very minimizing. I think at the bottom, it has to do with a lack of clarity cognitively. You're not seeing things clearly. You're not as sharp in your thinking. Your thinking isn't as crisp as it used to be. That's, I think, what people mean when they use the term, but we've done patients a real disservice, I think, by not defining it. I think a far better term is cognitive impairment. Cognitive impairment is a term that has some teeth, has some meat, if you will. And I think it highlights how significant this problem is. Often that cognitive impairment is brain injury. And in a way, to me, that's good news. Nobody wants a brain injury, but it's good news that we can label it accurately because we know how to treat brain injuries. And actually, we're pretty good at it. I'm not sure we know how to treat brain fog.